Stakeholders in the Corporate Accountability and Public Participation Africa (Cappa) and the Nigeria Tobacco Control Alliance (Ntca) have called on the federal government and lawmakers to strengthen laws and policies guiding tobacco control so as to sustain efforts towards putting an end to the scourge in the country. The call is coming on the heels of recent developments regarding bills introduced at the National Assembly aimed at reviewing Nigeria's Tobacco Control Act 2015. At a press conference on Wednesday in Abuja, the groups maintained that any review to the act must be in the interest of public health, as well as closing existing gaps and regulatory oversights the tobacco industry has been using to exploit the vulnerable population in Nigeria.
We want to again say that public health policies and the tobacco industry does not miss. The government should ensure that there are enough safeguards to protect our public health policies from the undue interference of the tobacco industry.
The Ntca and Cappa must say that we are deeply concerned about the increasing and inappropriate interactions between government actors and the tobacco industry. Despite the clear provisions of Section 18 of the National Tobacco Control Act, which prohibits the tobacco industry from influencing public health policies, forming partnerships with public institutions, or engaging in youth initiatives disguised as CSRO activities, the reverse is the case. Every day, we see it on the news and even online. The tobacco industry continues to partner with state governments openly. In fact, you read on the news and you see the tobacco industry also partnering with the National Youth Service Corps and even universities, which is very troubling. So we are urging the Nigerian government, public health authorities, and government functionaries, including legislators, to rigorously respect Section 18 of the National Tobacco Control Act, ensuring that all interactions with the tobacco industry are transparent and strictly regulatory. By addressing these violations and adopting amendments that genuinely prioritize public health, Nigeria can align its tobacco control framework with global best practices, protect its citizens, and hold the tobacco industry accountable.
We are saying that the Ministry of Health should be strengthened more to do their work. TCU should be strengthened more to do their work, instead of trying to take tobacco control to a particular agency of government. And I don't know any agency that maybe the framers of the law want to take it to that is not member of NATOC. If you are a member of NATOC, you are bringing your own contribution, your own expertise as an agency to control tobacco effectively.
When we talk about tobacco, it's not just about smoking. We cannot overemphasize this. We're talking about the Tobacco Control Act deals with the tobacco use. It deals with exposure to tobacco and its fumes. It deals with access to tobacco and all its allied products. It deals with the promotion and business of tobacco. So when you take a bill that then begins to narrow down to smoking, that is bringing it down to about 20% of what we currently have, which is even not yet enough. And so that, like my colleagues have said, the HB 1151 or whatever the numbers may be, needs to be completely jettisoned because it does not do us any favors.
So now, when you go on TikTok, you go on Facebook, you go on Instagram, you will see content curated to market certain products, tobacco products like vapes and all of that. And this is being sponsored by the industry. They know because there is no regulation within that space, and they are taking full advantage of that. Aside from that, they're also working with the so-called celebrities that we have in our country now, who are also not knowledgeable about the impact of what they are partnering on or with. So we would like to see a law that is paying more attention to marketing this product as it affects young people in particular, because These are the demographics that you will find in these spaces.
The tobacco epidemic remains one of the biggest public health threats across the world, as it accounts for more than 8 million deaths annually. Nigeria, like many other countries, is grappling with tobacco-related diseases as 28,000 citizens die every year due to complications arising from tobacco use. In a bid to address these challenges, the federal government had ratified the WHO Framework Convention on Tobacco Control in 2005 and enacted the National Tobacco Act 2015, signaling its commitment to end tobacco consumption in the country. Gloria Atta, reporting for Clearview News.